Hi, my name's Kayla, and I am a sufferer of medullary sponge kidney disease, otherwise known as MSK or Catchy-Reachy disease. I'm making this video today, sounding uber Minnesotan, to talk to you about a petition that one of my good friends, Mary Matson, has started on ipetitions.com. And what we're ultimately trying to do is get more research done on this really misunderstood yet really painful disease that is affecting quite a few of us. I'm just going to go ahead before getting into the condition and kind of talk about what a day with medullary sponge kidney is like for me. So first of all, I know a lot of people have showed you kidney stones before. These are mine. Can you see them? Maybe I'll take them out. There they are. Those are my kidney stones. Put them back carefully. That were removed during a ureteroscopy, papillotomy with holmium laser and stent placement back in 2009. I had this done on both kidneys, the right and the left, even though my right kidney is much worse. And then I had it done in 2010 with a different doctor. So, these are my stones that are in my kidneys, constantly causing me pain every single day. This fun thing, these fun things right here, are stents. And what they do is put these in your ureter, connecting from your kidney to your bladder after you have surgery, so that it drains better. These are the most excruciatingly painful things that you will ever experience. I promise you. Peeing hurts so bad after with these things. I had to be admitted to the hospital because I just couldn't do it. So many of us go through these many times a year in between surgeries and lithotripsies. It's just really bad. So I'm going to show you about all of the different medications that I take. It's pretty sad. I am 24 years old, and I am on 8 medications. So this first one is tamsulosin. It is to help stone passage. I don't take that every day. It's only when there's an active stone. Let's stick with, this is nitrofurantoin, which is a daily antibiotic that I need to take since I get so many kidney infections, UTIs, bladder infections every day, and this doesn't even work. I still get them even though I'm not supposed to get them. Penicillin, just in case I do get a breakthrough infection and I can't make it to the doctor. You know, I do try and lead a normal life. We have oxybutynin chloride. This is also to help stone passage. So now we're going to get into what helps me function, makes me feel less pain. This is methocarbamol. It's a muscle relaxer that I take up to 3 times a day. I don't really think it helps. I think it's a placebo effect, but you know, what can you do? This is oxycodone acetaminophen, otherwise known as Percocet, for pain, because it does get pretty bad. I have regular oxycodone. That's what I take when it gets really bad. And I have hydrocodone, otherwise known as Vicodin. And this is for just the daily aches and pains that I have to deal with. Without those medicines, I would not make it to work. I would not get out of bed every single day. Last but not least is ondansetron. I'm going to totally butcher that. And this is for nausea, because you'd imagine being on 7 different medications, especially the pain medications, you feel pretty sick. And you feel pretty sick when you have an infection and when you're passing a kidney stone as well. So, lifesavers. Oh, I forgot my favorite. This is azo. One of the true lifesavers of someone with MSK, as this makes peeing a whole lot easier. Okay, so now that I talked your ear off with my boring medication list, I am going to actually tell you a little about MSK, and I'm going to sound like Mary here and just read off something because I don't want to butcher it. Medullary sponge kidney is categorized as a rare congenital birth defect of the kidneys. It's known as a benign disorder that prevents the kidneys from filtering waste from the body properly. This results in hundreds of little kidney stones, I shouldn't say little and big kidney stones and calcifications in each kidney, as well as frequent UTIs, kidney infections, bladder infections, and blood in the urine. The current available research on MSK suggests that cases are sporadic and that it affects about one person per every 5,000 to 20,000 people in the United States, which is a pretty huge figure. There's a pretty huge discrepancy in that. So obviously research is needed. There's been no new research done on MSK until recently by a Dr. Amit Ghosh. And that was on January 5th, 2012. So quite a while ago when you consider the amount of health research that is produced every single year. I'm going to quote this from my friend Mary. This is what she wrote on the petition. There are people all over the U.S. and other countries that have been diagnosed with MSK, and we're all suffering from chronic pain and looking for answers. There are several support groups for MSK patients, including a Facebook that I started to make myself feel less crazy, since doctors often don't believe what you're saying and treat you like a pain med junkie, you know. So there's that one. There is MSK Forum on MedHelp, which has a lot of members, thousands. In both of these books, many people suffer with chronic pain. Many members face extreme difficulties in getting their doctors to acknowledge and come up with solutions. There's a lot of discrepancies. What works for one person doesn't work for the other person, and there's just no real answer for us. Currently, the status quo in treating this disease is the same across the board. You treat the UTIs, you treat the kidney infections, you remove the stones with lithotripsies and other surgeries as they come up. Many MSK patients have had repeated surgeries to get rid of the stones, but the surgeries were unsuccessful. The lithotripsies are particularly damaging to your kidneys. A lot of doctors don't like doing it, but unfortunately it's what we have to do to get relief. Many of us pass stones on a regular basis, from just small particles of sand to really, really big stones. The majority of us, like I said, are treated as drug addicts because the medical information states that we shouldn't be in pain, that there's no pain involved with this. A lot of doctors haven't even heard of MSK, especially when you do have to go into the ER. They look at you like you're a crazy person well, really, they just look at you like a crazy person, like you're a crazy person, unless they're just a really nice doctor or they're having a good day. Current research suggests that kidney failure among us is really rare, but a lot of us have declining kidney function, and it gets progressively worse with age. We're challenging the current diagnosis and prognosis. We're taking it a step further. It's not a benign disease. We suffer with severe chronic pain. The research is outdated. This is just so hard for me because this is something that I live with and struggle with on a daily basis. It's time to change. We really need to change. People need to come forward. People need to sign this petition. People need to realize that we're in pain, that what we're feeling is really real, and they need to help us. What they're doing isn't enough right now. One of the reasons why we think that MSK is so painful is that the kidneys are vital organs, just like the heart, just like the lungs. They're a filtering system for the entire body, and without them, you die. Every vital organ requires a constant blood supply, and every organ has nerves in it. Even your teeth have nerves, and they're not vital organs. Why would the kidneys be any different? Why would we not be experiencing pain when our kidneys are calcifying and stones are forming and moving around? If you were born with MSK, which all of us are, it's a congenital disorder, your kidneys did not form correctly when you were still in the womb. The little tiny tubules inside them cannot filter properly, so calcifications form jagged crystals in the kidneys. As the waste backs up, the crystals bind with the oxalates in most cases and turn into stones, literally, rock hard stones. Essentially, there are thousands of these jagged, tiny little crystals and rocks in us. And with every movement and with every breath that we take, all of these crystals and stones are rubbing, grinding, and shredding the insides of our kidneys. How could this not be painful? How doctors don't understand this and realize that this is excruciating baffles me. We've kind of been starting to do a lot of outreach right now. We've contacted the American Pain Association, who actually has been really helpful and did put MSK on their website as a chronic pain condition. I wrote into a lot of different disability websites about my disease, and they've been really helpful, and they've put my story on. Mary Matson, who started this position, was featured in an article written by Radley Belko on the Huffington Post about chronic pain and how hard it is for us to access pain medication, especially in the southern states. I'm really blessed to live in Minnesota, where the use of narcotics and the watchfulness of narcotics isn't as bad as it is in, say, Florida or Kentucky, the Appalachian states type things. So definitely check that out. It's a 3-part series. It's really awesome. Even if you're not interested in MSK, it does talk about a lot of other different chronic pain conditions as well. Ultimately, what I'm asking you to do is help us change the views of the medical community when it comes to MSK. We started a public awareness campaign to get funding and research implemented. Many of us have written our personal stories on how MSK has affected us over the years, and we hope to turn that into someone who's willing to listen. There's no cure right now, and we all have to deal with this for the rest of our lives, and we can't keep doing what we're doing. I speak for myself. I'm a 24-year-old girl. I'm a recent college graduate. I work full-time as a research coordinator at the University of Minnesota, and I love what I do, but this disease makes it very, very hard for me to function and live a normal life. Work comes first, and I hope to go to grad school, and those two things come first. So living with MSK, there doesn't leave room for much else besides what you need to do. My social life has gone from really, really fun and doing a lot of stuff to pretty much absolutely nothing. I come home, I'm home from work right now, and here's what I do. I take my pain medicine, and I sit on this heating pad. This heating pad is attached to me pretty much at all times. I travel with it. I have a heating pad at work. This is obviously the best. It's the wraparound one. Put that back. So I mean, it's extremely debilitating, and we need help. We need a cure. We need someone to listen. We need someone to take us seriously. And that's why I'm hoping that when you see this video, you will sign the petition for us, and please help us spread the word about medullary sponge kidney. If you have any questions, you can find us on our Facebook. It's just Medullary Sponge Kidney. Otherwise, just look it up and just know that not everything you read about it is true, and that more research does need to be done. So what you can do to sign our research petition is go to ipetitions.com. And I believe you can just type in medullary sponge kidney. I'll definitely post a link along with this video. So thank you for listening to my 14-minute rant about medullary sponge kidney, and let's cross our fingers that something gets done really soon so future generations don't have to deal with this, or at least can deal with it and manage it much better than us. Thank you.